So we're doing your neck, right? How much time do we have today before the next client comes in?
I think we have significant amount
30
of time
minutes?
because they even more because they canceled.
Oh, okay.
We have just Sharmova, which is
Oh,
doing the treatment and also canceled.
okay. So maybe I'll start from your neck and chin and we can go up to your...
You have half an hour.
Okay. So basically, because we're doing mostly neck today and neck and chin, so we're gonna start from the neck. And as I tighten the neck, I just do the two sides so that it will avoid here, because sometimes people get itchy and they feel the urge to swallow, which is okay, but if we don't need to treat there, we don't need to. But unless people have like really a lot of laxity there, then we'll treat there. But for now, put pressure and treat the part where you have loose skin. And then as I treat here,
But you're doing it slowly.
okay, yeah. And then I'm giving some pressure, but because it's neck, so I don't need to press a lot of pressure, just moderate pressure. And then you can film from this side, Dr. Nazra, and you can see like more puffiness coming in. Because when we treat the neck, most of the loose tissue gonna accumulate here, and it's really interesting. Then we end up saving the last 10 minutes to treat her, like here, push up. But now, since we're just starting the treatment, we're still focusing on the neck area to get the best fat reduction and tightening. So she doesn't have much fat at her neck. If she had like a really bulky, a lot of accumulation of big neck problem, then you could go to like level 2 for the neck part, but never level 2 for up here though. You would go back to 1 when we treat the loose skin eventually for long hair.
Mainly because of tolerance issue, not because of any risk.
Right, it's not risk, it's just how people
Because it's
feel
gonna be close to
too
the
loud.
tympanic.
So she didn't
Yeah.
say jawline to you, that's why you're concentrating on the neck.
Yeah,
correct?
for now. And then I'm gonna, like 5 minutes into it, I'm gonna try to do some jawline, like long here. But for now, I'm just doing this. And then I'm looking at the soft tissue accumulating here, which is what I expected to see. But the lady that you guys mentioned to me, I didn't see her picture, but if she had like a lot of fat here, you could do level 2 on the neck for her.
I think Des did 2
Yeah.
and 3.
Oh, really?
Uh-huh.
Wow. Okay. Then that should disrupt some fat for her and tighten at the same time.
You know, some people don't want to admit they have to go on a weight loss journey, you know?
Oh, that's where the doctor comes in.
Yeah. It's true. You say,
Convince them.
Gonna change
you
the-
say, look, we can give you an improvement,
Yeah.
but if you want it to be a significant, noticeable improvement to everyone else,
Mm-hmm.
we suggest you go on a weight loss journey
Exactly.
simultaneously.
Yeah. So not everyone has scheduled like doctor consultation, or do they all go through
Not everyone.
doctor before? Okay. Yeah. I think
People are seriously.
they can see you, and you can teach them how to be having like healthy diet, and even if they need to do GLP-1, right?
So like if I'm asking you like more or less, how would you equate your pressure in terms of pounds? I know it's difficult, but just more or less.
Yeah, I think it's a 0 or 4. If
Pretty
10,
standard.
if 10 is like the hardest, I'm only using 30% of the strength.
PRX, we do 4 practice.
Yeah.
and I use the food scale.
Yeah.
Four.
Two.
Four.
So she was when she came to us.
Yeah.
Yeah, it's the setting and also the pressure. I think if whoever did that lady with a lot of fat on her neck, if they were not putting pressure, that could have, the results could be compromised too.
Well, we don't know what she does when she leaves here. Does she go home and eat a bag of potato chips and whatever else, or does she drink a lot of water? Does she drink a lot of alcohol? There's a lot of variables.
Did you want to go to the bathroom before leaving?
Yeah. See, none of us have done what you're doing.
Really?
Yes, it was mostly under, not to touch the neck.
Yeah, but for your case, you had like more skin laxity on the neck, so that's why I start from the neck. But when you charge, it's two packages. The face is a different package. The neck is another package.
And how much time you get for the neck? About half an hour?
Half an hour? Yeah.
And then it does not include the jawline?
Yeah, I mean, that's how we do it. We do
I think
neck and jawline.
Yeah, depends on how big of a neck. She doesn't have a big neck, so for her case, I'm gonna do about 15 minutes of the neck, about 10 minutes of the jawline, and then like the last 10 minutes we'll do the ear, the last 7 or 8 minutes. So like I can do this, and then you're gonna see as I tighten her jawline, the soft tissue would continue pile up here. And if you like poke with your finger, you can feel it actually. And then I'm also looking at her straight from her above her face, because I want to make sure her chin gets even before I finish the treatment. Because now you take a photo, her chin this side is tighter, yeah, than the other side. And then now I'm just gonna lift some of the soft tissue up. And then if you see her face, this side is actually tighter than this side.
So the only thing she's looking for the first how long was just what you see there.
Yeah, I did this because she has more wrinkles here than her face. So I want to really smooth out her neck and tighten her neck. And then, sorry, what did I say?
No. No, but this is like a different technique. When I was doing it by myself, kind of, I was just going under the chin.
Yeah.
Because I had the impression we cannot touch the neck. I don't know why.
Neck is, yeah, you can touch the neck, but it's just depends on what package you're selling to the clients or what treatment you're giving. So for the jaw, this is what you guys usually do, right?
Yes.
Yeah.
So it means you are doing separate package for the neck and for the jawline?
Yes.
The videos that I have of training aren't like this.
The jawline, right? It was we were doing this, right?
Yeah.
Yes. So later on, I found that it's actually more effective to do it this way because the tendons are concentrated here. So we're gonna make a new video. So like when I'm pushing, I found it like really effective. The tendons are picking up the loose tissue very effectively. So everything that gets tightened from the neck and the jawline all goes here. Yeah. And then I'm just repeating because after this tightens, see, there's almost no softness anymore. And then I'm gonna go here and you can see another 5 minutes of treating neck and jawline. Here there's gonna be another soft tissue accumulation, which I will eventually send it up.
So after 3 or 5 sessions, package, regardless. Some would need 3, some would need 5.
Yes.
Yeah, this is different. This is like really different.
Yeah.
So they say, how long will I have the results? How long
It's
this
actually
is
permanent, but then I don't really say that to them. I just say it lasts at least 6 months because, like Karen is saying, you can't control what they do. If they drink alcohol, they eat fatty food, they're gonna
every day,
gain
right?
weight.
Yeah.
Yeah, what they gain is gonna all part of it accumulates here.
I go,
So
just an example, I'd go, well, Beyond, it looks like you've been spending some time in the sun. You go in the sun,
Me?
you wear sun protection. No, all of these things matter.
yeah.
All of these things.
Yeah, the lady with the laxity on her knee was in a boat for hours without covering her legs. She wore shorts. She said they went on
They
water.
don't want to admit that the sun will break it down.
Yeah.
It is.
And she didn't drink much water either. She said 2 bottles a day, small bottles. That's all she says. I said no, you're gonna have to drink at least 6 to 10. But still, the results is really good that Megan did today for her. So I would just say 3 to 6 months at least. Yeah, the results are actually permanent. We had tissue biopsy data. We saw that it's changing the cells. Yeah.
Yes, I definitely feel the pressure. You know, it's like you are milking it, kind of.
Yes. I don't want to say it, but it's almost like you're ironing the clothes. You know, like you're making it smooth and tight. You know, using the transducer.
Yeah, it took me many years to realize as a young adult that if you actually apply pressure to the iron,
It actually
the
works
iron's quicker
better.
and better than if
Yeah.
you just glide it on the clothes.
Now her this side is tighter than this side.
Press.
See? Right?
So leave it.
Like this. So I gave-
You see it?
Yeah. You see this side is puffier. This side is more tighter, lifted.
More defined.
Yeah. Yeah.
More importantly, as soon as she touches, as soon as she meets your skin, you can see it all lift up. So like it almost like moves towards the handpiece, right?
Yeah, it's
just
going
like
with it.
Just
Yes.
kind of pulls it up. You can
Yeah.
really see
Yeah.
the tissue.
Yeah.
Yeah.
And then Dr. Nazara could be nervous because after treatment, yada, you go out, and then guys gonna start asking you for phone numbers, and that's just so true. Like I have guys like talking to me all the time now. Yeah, I'm not joking. Like at the gas station, in the supermarket, everywhere.
Well, that's what we do the errands and
Yeah, a lot of our teams are saying that too. Like Carrie Ann, the esthetician, she's in her early 60s. So she said, like, guys were knocking on her window and asking for her phone number. Yeah,
I haven't had
because
that
she's so
problem
much
yet.
glowing.
How do I get that problem?
Yeah. They said, can we have coffee? Yeah. I know. I had this guy in San Diego, like she said, oh, is that French bread? What kind of yogurt are you getting? You just wouldn't stop talking. And I'm like, I'm not even local. How do I know what the store has, right? And then he kept saying, oh, I'm a doctor. I really want to date you. I said, sorry, I'm not local. And then he started asking me, what do you do? So I told him about the device, and he said, no, this is how you talk to doctors. You don't tell them like 30 minutes is all lifted and tight, because they won't believe you. What you say is, when we're young, our tendon is this short, and then now, after we age, tendons are this long. And then with the device, you're shortening the tendon. He started to give me like this whole medical discussion in the supermarket in San Diego. Yeah, he's like really funny doctor.
We don't know if he even was a doctor. Maybe he just wanted to
Yeah,
date you.
exactly.
He said he is.
Especially when he was talking about shortening the tendons.
I know. Yes, I think there's something like about the youth, because maybe it's the apple cheek. Like, maybe
You're right, there
this
is a-
attracts guys or the skin. I don't know.
The only time that my husband has an appreciation for my career is when we're in a social situation where his friends' wives are there.
Oh,
And we're
they're
all in
all.
the same age range, and he
Oh.
goes, "Holy crap!"
Oh, he can
right.
see.
He finally, all of a sudden, he goes, "You're
He
right."
appreciates you, yes.
Then all of a sudden, he's like, "Wow."
You know, I remember when we were in Edison, it was like a women expo. And the guy actually told his girlfriend, who was like in the 20s, that Karen looks better than she does.
Right
It was
to her
like
face.
it was like really it was so embarrassing for her.
It was terrible. I was mortified. I said, "Well, you're going to be in the doghouse
but you
today,
remember-
let me tell you that."
But you remember this, yeah.
Oh, yeah. We were stunned. We couldn't believe he said it.
Did she get angry? Jealous?
I'm sure she was embarrassed.
Just have him walk off.
I know. Yeah, but I'm happy that women are getting more confident after the treatment, you know? Yeah, so now this side and this side are pretty even. The look, you see her neck. And looks like this side needs more treatment. Because this side is tighter. Then I will add more cream. So like with the neck, I don't think it, like you're drinking water, right? She didn't use that much cream at all. It's a good,
More coffee than water, but
yeah.
altogether.
Definitely good water. This
What is
cream.
later on?
What are your
Hydrogenated.
Really? Oh, you bought those
It's
bottles?
anti-inflammatory.
Oh, you bought those bottles, or how do you make it?
Just the pills.
Oh, really? I heard about it. Yeah, I saw them having a booth at the anti-aging conference in Vegas.
But it's not that, you know, I have tendency of doing something, but I really don't stick to it. It's like I'm bringing stuff here, but nobody really sells it except Karen Glutathione. Thank you, Mary Argilagos. Otherwise, it stands here, and also Mega, also Karen sold it. But people don't, like really
They don't
So
try
I
it?
really don't want to compete with health food stores, or I'm just bringing something to somebody's attention, and then it's up to them if they want to follow up with this or not. Like now we have glutathione, transdermal, which is actually
Transdermal,
is it's really amazing. It's better even than liposomal because it doesn't get, and even better than IV because it bypasses the bloodstream and blood or stomach acids. It goes exactly immediately to mitochondria.
You have to put four sprays in the morning, 4 sprays at night.
Oh, it's a spray.
Yeah.
Oh,
And actually, it's done, but you can put it anywhere on the body.
Skin. Oh,
Back
nice.
of the knees or here, back of the knees or where you want it.
And the same magnesium. We have a couple of them, reactive magnesium and threonate. And if people realize how important it is for you, we would have like 10% less death. I don't know. I remember it was like one of the 10 leading causes of death in the United States, lack of magnesium.
Yes. Yeah, glutathione brightens the skin.
Yes. We had somebody who actually was taking glutathione and he reversed his gray hair.
Oh, yeah. Wow.
He was given 60 grams of IV twice a week.
IV.
It was NP actually, yes, Dr. Nadra?
Yeah.
No, but I'm so happy that Dr. Jiang came, Mariel, because it gives us a new protocol. Because we were all sticking to the bone, going up, but she's showing us that actually if you work on the neck, you have to start in here 5 minutes, small movements, and then you're going around your chin, jawline, and up, not down at all during the...
Yes, and then you see how the loose tissue would go here, and then we would just go like this, and then the tendons will pick it up.
How did Mrs. Sharnoff like the treatment?
She loved it. I think she's gonna get the package. She's just eating. Sabrina bought it.
She's got cherry also.
I think she's gonna do a body though, not face, for the package.
Yeah, because she does the arms.
And then we're another 10 minutes left. Do you want to do the eyebrow?
Absolutely, yes.
Let's do the. So I kind of open this.
Absolutely.
Yeah. And then you can.
No, I want actually, Dr. Nazar, I want my husband to see it because sometimes the estheticians are busy with other treatments.
They don't
And
remember.
he does the consult, and actually it's like asking for UltraSculpt.
Oh yes.
And then he doesn't have to really wait for them. He can start doing it.
Oh really? Okay, good. Yeah. Yeah, that way it's more efficient.
Yes, not only efficient, but also he's got incredible eye.
Oh,
You know,
yes.
and you know, we
he
were
sees the
with, I don't
face.
know if you are familiar, doctor, the one who does facelift,
Okay.
Dr. Trokel, and we went out to dinner, and like the first
See,
minutes of
like
conversation,
Yeah.
he said that my husband is like kind of Da Vinci of this time, because no matter what subject, he's becoming like perfectionist to the point that nobody can beat him. So if he can master it.
And then like I even can go to like for save time, I can go to 2, and you feel good, right?
Yes.
2 is okay.
Yes.
Okay. Because 2 would move the upper face even faster than 1. But we're just trying to balance the noise level with customers, you know, comfortness
You do
with
it
the
a little bit
efficacy.
faster than,
Yeah, because I know there's a big tendon underneath there. As I stimulate here, it'll stretch her forehead, and then her eyebrow moving up. Yeah. And then like even you can see her right side is higher than left side. Can you see the eyebrow? It doesn't move the same speed, which is normal. Like nobody moves the same speed. And then with this part, we just have to remember to keep adding cream because the hair does absorb a lot of cream, and it's good for her hair, the hair follicle. Yeah. But if I just do this for 5 minutes, it's a really nice move up of her eyebrow and eyes. And stretch of her forehead. But you can see, like even I'm doing directly above in the middle, her right side is higher than her left side. And then I just do this side. Just I call the tendon here to push up more because the whole face is connected. Whatever I already picked up from the loose tissue here, I can push all the way to that big tendon up there. So her eyes and eyebrow are moving up as I do this. See? Like you can see her outer corner of her eye, and the eyebrow are moving up very well. Even each time I'm doing this, it's moving Because the tendon are contracting as we use the ultrasound to stimulate the tendons. See, now this side is really higher than the other side. Okay, you want to take a photo of her
Yeah,
face?
no, I actually have it
You
on a
can
picture.
see? Yeah, yeah, good.
Yeah, I have it in a video. I mean,
Okay, I'll
Do you
take
see
a
that?
photo
You see
too.
it?
yeah, I'll
Yeah.
show it to you.
Yeah. Okay. And then I'm gonna do more of the left side so that it's gonna be the same as the right side. The lifting.
So you're always doing kifala, never.
Hmm?
You're always doing it.
Yeah,
never
like
down.
stimulating the tendon.
Yeah, but never-
Yes, telling the tendon to shorten. When I do it this way, you know, the ultrasound is stimulating the tendon in the fascia layer to shorten it. And her apple cheek, this side is also very plump and started to move up at that side. So this would also reduce her nasolabial fold because we're tightening the tendons here.
When you say the tendon, you mean like the aponeurosis frontalis?
Yeah, in the fascia layer, we have all these tendons that are hanging our, like the 4 layers of our face to our skull. So we found the frequency that would stimulate the tendon and with the right depth. So this side moves very fast. See, every movement, her eyebrow is going up as we speak. See? The other side takes a couple more minutes, but still moves up. It's just slower. We always have a slow side and a fast side. And for her, the right side moves faster than left. So it's very important that whoever is doing the treatment to look based on how they move and not just by time, because they want to give a very even, symmetrical effect. So when I push this way, the tightening is the most effective that I found. And then I go back here to, now that 2 sides are both tight, I'm going to go back here to further lift the forehead. So the whole face is moving up.
And how soon can they use makeup?
Immediately.
Yeah, they can put the serum on right after. And then they can put their moisturizer on top of the serum or whatever they use. And we're testing a serum for hair growth and getting really good results. Like 80-year-olds are growing hairs.
The serum?
Yeah.
Amazing.
Yeah, so
And
we use
amazing.
UltraSculpt to contact into the scalp, and then in 3 to 4 weeks, they apply more at home, and they get like 4 UltraSculpt treatments, 1 a week to conduct the hair growth serum, and they continue to use it at home, and they will grow hair in 4 weeks.
And how do you do it to the hair?
The same
We have exosome in our serum, and then also the
in this microRNA, or it's a different serum?
It's a different exosome, yeah, that we made from stem cells. So, because the hair growth takes more than one RNA, it takes like a group of growth factors mixed together. So,
Yeah, but I mean, like you apply the ultrasound on the scalp
yeah,
in the areas that are hair thinning.
yes.
So what do you do? Like you kind
You put the serum on,
You
you roll it
part-
on, and then you use this.
part of the hair, and then you.
Yeah,
and
yeah.
It doesn't matter one direction, two directions.
Just circular movement in the bald spot. But like we've been testing that protocol for a while now. Wow, she looks so tight. And also like when we do the the face lifting, her eye bag would be reduced too. So because one of the reasons that we have like eye bags under our eyes are because we are sagging. Yeah.
So you're not gonna work on any little probe
Little probe for
to
face.
go under the eyes?
Yeah, they like it's kind of I don't want to because of the potential liability, right? Because I know people get fillers and Botox, so I don't want to interfere with what they were already doing.
But if they don't have Botox or fillers, like in my case, I don't have anything.
Right, I don't have anything either.
So you would do it or not?
Yeah, with smaller head, mostly for like you don't have it, but some ladies have like these smoker lines, like between the nose and the lip. Yeah, mostly for that area. I haven't tested for the eye. I'm like extra careful. I don't want to touch the eye too much. It's too sensitive. So the last few minutes, I'm just gonna give it to this side because I want to match the eyebrow and the eyes. Yeah, so start with 1, and if the patient can tolerate, go to 2, because 2 makes the effect even more prominent. Yeah, it's just the noise a little bigger, but in her case, she doesn't mind. So, yes, I'll do a little bit of the neck too.
You know, I thought that all aestheticians, everybody should be here watching you. I'm just curious.
Yeah, they saw earlier what I was doing.
Oh, I see.
Yeah. And then the doctor has the video. Yeah, we want to make a training video for the face, neck again, and now also we want to make a new one for like buttock area because that's getting very popular. People really want to lift their butt.
Yeah, we don't have that protocol for the body.
You have it on the sheet of paper, but I want to do a video. A video. Yeah, it's half an hour too. Level 8. So because the whole face is connected, the minute I'm lifting the eye and eyebrow and forehead, I'm gonna get down here and push more loose tissue up from the neck and the jaw area. Because you want the upper face to move up, and then the tendon can pick up even more loose tissue from the jawline and the neck afterwards. I'm gonna add some more cream. So for neck to be tight, we have to push up a lot of the loose tissue for the face tendon, the tendons underneath the face in front of the ear to pick up. And with plenty of cream, I can move a little slower if I want that tightening effect to be very good. But definitely
With the
with
more cream, you can move slower, so
Yes.
it's actually better result if you're doing it slower,
yes,
slowly.
yeah, because I don't want to. If without cream, I cannot go this slow because the client will feel like body like not awkward feeling, not comfortable. They'll feel warm, too warm.
And if there was fat, you change the setting. If she has like some mental fat, you change.
Yeah, I would go to 2, but then I'll give more pressure. Like today, I didn't put. I'm only 30% pressure, but for like someone with a lot of fat, then I'll do 60% pressure. Because the pressure makes.
Too, right? Which is
Yes.
using right?
Yeah, yeah. Yeah, as I tighten her neck, more soft tissue accumulation here. Like, see? Yeah. And then if you could turn your face a little bit, and I'll take care of all that by pushing it up. See, even just a couple stroke, see? Like, the soft tissue is not there anymore. It's really effective doing this. Let's do this side too. Then we'll be done in 30 seconds. Yep, you're done.
Thank you so much.
So that's a 35 minutes. So normally you charge clients for 2 package. But today I did an accelerated version, which I did a 2 instead of a 1. So I did it in 35 minutes, both your neck and your face.
This is
Normally
amazing.
you can charge like 2 packages. And
This is
then,
absolutely amazing.
yeah, take a photo of her face.
But I think also like you I could feel it. You
Tight,
have the
right?
creator. No, you did amazing job.
Okay, good. Do you feel tight?
We have to train everybody on it, on this technique, because nobody does it.
I'm gonna keep watching this video. So I
Yeah,
can-
yes, because everybody was doing just like this.
Yeah, there's certain technique. Not very hard, but they just need to
Yeah.
do it. Yeah.